We have a massive problem. We just got done talking about the budget and talking about the deficit, but there is no possible way to address that without addressing health care. Health care is the biggest spending item for the government. One out of every $5 spent by the government is spent on health care, and it is the quickest growing inflationary cost to Americans. Right now, if you consider Medicaid and Medicare, you consider the amount of money we spend on private pay, which is about 1/5 the economy also, in a GDP of roughly $24 trillion, you're spending $6 trillion on healthcare alone. If it were taken by itself, it would be the third largest GDP in the world. It would have twice the GDP size of India, which has 1.47 billion people. This is a massive problem. So what are we going to do? How do we take on something so complex? I think it's an underserved problem in the United States Congress. We've been kicking the can down the street for far too long, both from the Clinton administration all the way through the Obama administration. The Affordable Care Act did nothing to make it affordable. We've done nothing to curb the inflationary costs. And it's certainly not the doctors' problem, because doctors took a 2.3% pay cut last year alone. If you're an ER doctor in Georgia, you probably took about an 18% pay decrease in 1 year. And that's after serving during COVID for 3 years, on nights, weekends, and holidays. That is your congratulations. So how do we address this? Quite frankly, we're going to have to make some hard choices. And America has to understand, first of all, how complex this issue is. When you have PBMs, GPOs, pharmaceutical companies, insurance companies, Medicaid, Medicare, when you have the government involved, private pay, when you have hospital systems, when you have healthcare providers. These are just some of the problems we have. Right now we have 90% of the ingredients that go into drugs produced in China. You have almost all the market for amoxicillin and Augmentin cornered by an adversarial nation. We have admin costs that have grown in the hospital system from 25% to 40% just in the last 10 years. Take that into account. 40% of every dollar spent on healthcare is spent on administrative costs. That means too much regulatory burden. That means not enough competition. And we continue to talk about a single-payer system as the end-all, be-all to healthcare. Let's take that into account right now. Medicaid is done at a loss. It doesn't pay the bills. As a matter of fact, we have an act right now that talks about supplementing people with a tax break so that they can actually see more Medicaid patients and afford it and stay open. It's not the answer. If we go to a single-payer system, you're talking about adding $30 trillion of expense to the government in the next 10 years. That means $30 trillion more in either tax or debt.
Hello, friends. I have good news to share with you this Sunday. More relief can be expected thanks to President Biden's Inflation Reduction Act. For some Medicare recipients, prescription costs may be much less starting this month. Recipients could save hundreds of dollars, and experts are also urging that Americans check if they qualify for extra aid, as billions of dollars in benefits go unused every year. My friends, please make sure that you watch until the end of this video to hear about all of these details. Also, this coming Friday, I will be announcing more winners for the Walmart gift card giveaway. If you would like to enter these weekly giveaway, friends, all you will need to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, my friends, the greater your chances of winning the giveaways. Some Medicare recipients may soon pay less for their prescriptions. On Friday, the Department of Health and Human Services announced 43 prescriptions will have lower copays for Medicare Part B beneficiaries between July and September. This could save Medicare recipients who take the prescription drugs between $1 and $449 per average dose. It is part of the Biden administration's Inflation Reduction Act, which aims to lower prescription prices if their prices rise faster than inflation. These 43 prescription drugs had prices that did rise faster than the rate of inflation in a benchmark quarter. Although the price adjustment only applies from July 1st to September 30th, inflation rates could cause a list to grow, shrink, or stay the same beyond that period. Xavier Becerra, the Secretary of Department of Health and Human Services, said in a recent statement, "With the inflation rebate program, we are fighting to ensure seniors can afford the treatments they need. Taxpayers are not subsidizing prescription company excess prices, and the Medicare program is strong for millions of beneficiaries, now and in the future. The law requires manufacturers of qualifying prescriptions to pay rebates to Medicare if a prescription's price increase exceeds the inflation rate. However, the manufacturers who owe the rebates to Medicare this year and next year will not receive their first invoices until 2025. Starting in 2026, the law will also allow Medicare to negotiate prices for certain prescriptions. Medicare Part B recipients will be able to start negotiations then for prices effective in 2028. These policies will help many Medicare Part B beneficiaries whose spending on prescriptions has grown massively in recent years. Along with the announcement on Friday, the Department of Health and Human Services released a report that found that per enrollee, it found prescription spending grew on average 9.2% annually. Medicare is a main source of health insurance coverage for 65 million Americans and a major source of revenue for hospitals and other healthcare providers. Medicare is a main source of health insurance coverage for 65 million Americans and a major source of revenue for hospitals, other healthcare providers, and health insurers that offer Medicare Advantage plans. Over the years, policymakers have debated major changes to Medicare, driven by concerns about solvency, sustainability, and affordability, propelled by an aging population and system-wide increases in healthcare spending. While the possibility of reducing Medicare spending emerged recently during the debt limit negotiations, and some members of Congress continue to talk about changes to the program, President Biden and House Speaker McCarthy have both declared that Medicare will not be changed. Older adults leave billions of dollars in government aid on the table each year and do not even realize it. That money could go to cover utilities, rent, health care, prescriptions, and groceries, especially at a time when inflation remains stubbornly high. Consumers are paying more for everything from eggs to prescription medicines. Several federally funded programs can prove effective in defraying some of those increases, yet they go unused year after year. Take the federal government's SNAP program. This program provides eligible individuals with monthly benefits to purchase groceries at participating supermarkets and farmers markets, while 26 million adults aged 50 and older were eligible to receive SNAP in 2018. AARP found that 63% of seniors did not take advantage of this benefit. The numbers have not improved much since then. To help older adults cover health care expenses, the federal government also operates the Medicare Savings Program, which helps pay eligible older adults Part A and Part B deductibles, co-insurance, and co-payments. Older adults can save more than $2,000 per year through this program. Yet more than 3 million eligible adults, 65 and older, are not enrolled, leaving $2.5 billion to $6 billion in benefits unused each year. So, dear friends, please make sure to take action so that you can claim these benefits that are available to you. Well, my beautiful and most amazing friends, that is the end of my daily stimulus update video for this Sunday. My dearest friends, thank you very much for being here and for being part of this community. To say thank you and to show my appreciation, I will be announcing more winners for the Walmart gift card giveaway this coming Friday. If you would like to enter the weekly giveaway, all you will need to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you watch and then comment on my friends, the greater your chances of winning the giveaways. Thank you, friends, and have a wonderful and very blessed week.